by definition, urinary incontinence is loss of urine at an undesirable time. And there's different types of urinary incontinence. There's stress urinary incontinence, which can occur with increased abdominal pressure, and that can be associated with activities such as laughing, moving, exercise, and so on. And the other type of urinary incontinence is urgency incontinence, where there could be an urge to go to the bathroom when the bladder's not all the way full, and there can be associated urinary incontinence along with that. Now this can occur and be precipitated by things like tap water draining, or if you're getting close to the bathroom and you're getting your key in the door and all of a sudden it's, I've got to go to the bathroom. The most commonly incidences where there is incontinence is postpartum, after delivery, and in people that are aging. And there's a lot of different things that could be going on. After delivery, there could be weaknesses in the pelvic floor muscles that precipitate an increased incidence. As you age, the nerve control or the messages in the bladder can get a little bit, they can change, which will result in the urgency. So the most important thing, if you have experiences with urinary incontinence, is to be able to talk about it. And of course, to share it with your physician is very important. And if you go in to check on this issue, the doctor is going to be concerned, and we'll start off with a very good, thorough history and physical examination and try to identify factors that might be important to be considered when looking at treatment. And the other thing is, everybody should have a physical examination and a urine sample done to rule out any significant causes. The urinary incontinence can be simply treated with a primary care physician. In some cases, that is all that's needed, and there may be a referral to a specialist like myself for in urology, and additional testing and information might be sought when you do come in. When you come in to see me as a patient, I'll be interested in inquiring about how often you're going to the bathroom, what are the circumstances around the problem that you're having with urinary incontinence, perhaps if you've had any treatments to date, those sorts of things I'll be interested in. As far as management of urinary incontinence, there's a variety of options that we can look at. And some of the simple ones is fluid management, time voiding. That means, being conscientious of the time at going to the bathroom rather than wait to the bitter end when your bladder is full and there is going to be a significant urge and you're more prone to have incontinence then. In addition, there's exercises that can be done and also medications that can be taken. If in fact these simpler conservative measures are not satisfactory, additional treatment can be done, including surgical procedures. The Kegel exercises are involving exercising and training the pelvic floor muscles so that there can be bulking of the muscle, and in most cases help with the incontinence, and it can help with both the stress and the urgency incontinence. And there's been well documented improvements if the pregnant people are doing the exercises before and continuing them after, especially if there has been any kind of instrumentation with delivery and or if there's been a large baby. That will take us on a different course, and you will be evaluated with testing of the kidneys and also a cystoscopy, which involves looking inside the bladder and to make sure that there's no abnormality that could be causing that. it is not abnormal to have occasional episodes of incontinence with giggling or laughing. It's the incontinence that is repetitive, that you use protective clothing, or it's bothersome to you, that is a good idea to speak to your family doctor about and get some treatment for.